Hi, everyone. Welcome to Face Facts. On today's podcast, we are talking all you need to know about Sculptra. Sculptra is increasingly popular. This is a polylactic acid injectable, and this is something that we use both in the face, the neck, the body, and even the bum. We've talked about things that you need to know, risks associated with this procedure, and how it can be used. This is one not to be missed. I hope you enjoy. Hi, Holly. Lovely to have you on the podcast today. Welcome.
Thank you. Lovely to be here.
So for anyone who hasn't met Holly before, don't know where you've been. Holly's been on our podcast before. Holly is a skin therapist that works in my Liverpool clinic, and she's amazing. She does all things skin, body contouring. You do a lot of body contouring, lasers soon to be added onto your portfolio, microneedling, and supports in clinic generally speaking. So thank you for being my right-hand lady. I know you've come equipped with a lot of questions.
Yes.
So tell everyone what we're talking about today.
So today we are going to talk about Sculptra. We want to find out more about Sculptra, what areas we can treat, and the benefits of it as well.
Mm-hmm. So this is a treatment that has become particularly popular, I'd say, over the last 18 months in clinic.
Yes, very.
And we're seeing people moving towards a trend of having this treatment done, although it's been around for 30 years, because I have a strong ethos of not running after trends, and that the products or treatments that we offer need to stand the test of time. And trends come and go. So I've seen a lot of trends come and go. Sculptra has been one of those treatments that has been used globally, is a global product, and has over 30 years of history behind it. So we know that it works, and we know that it works really well. And now with the advent of social media, everyone's talking about it. I think it's really taken off in the United Kingdom over the last 18 months. Although, like I say, it's been around for a long time. I used to use it about 10 years ago, and then I stopped using it and I started once again. And the reason why is because Sculptra actually is a polylactic acid. Big name. You can shorten it for PLLA. PLLA means essentially it's a biopolymer. It's a biodegradable injectable. And when we inject it, it's utilized to stimulate collagen. So it's not a filler, but it is a collagen stimulator. And when it first came out, it was used for patients who had HIV. So patients who had HIV lipoatrophy or lipodystrophy, which is fat loss associated with human immunodeficiency virus, is a very common symptom of HIV. So people lost a lot of weight in their face. They lost the structural support, and they started to look quite gaunt and unhealthy. Polylactic acid, or Sculptra, PLLA, was used to treat and stimulate collagen and volume in those with extreme volume deficiencies. So now it's used more as a skin rejuvenator and in all patients for age-related lipoatrophy and reversal sun damage. So it's really interesting, and it's kind of evolved over time. So back in the day, when I was using it about 10 years ago, what we would do is we would mix it and then leave it to stand for 72 hours and then use it. But I think the way that we were using it, the injectable technique, the dilution has somewhat changed. In the past, there was fear around using it because you couldn't stop the formation of collagen or volume. So the fear was, well, if we inject it, how much volume does that patient get, right? So how can you predict the end result? Because everyone's different, Holly. You're different to me, I'm different to Dylan. The amount of collagen we're going to stimulate and volume that our bodies will synthesize, will produce, is different patient to patient. So the fear around PLLA back in the day was we can't predict the end outcome. And also the fear that it may hyperstimulate collagen and you will get little nodules around the actual product. And so me being risk averse, I like to sleep well at night. I like to keep my patients safe. I made a decision back then to stop using it because I didn't like that unpredictability factor. And I need to know that whatever I'm injecting in my patients is going to look good, not just today, but in a month, in a year's time, and moving forward. So I stopped using it. And then about 2 years ago, it kind of got reformulated. The way that we used it changed. The injectable technique changed. The dilution and the way that we dilute it and then use it immediately has all changed because science is never a hard fact. Science develops over time, and we consistently and continuously learn and develop. And since that new formulation, I've been exceptionally happy with it, and I've picked it back up again. And I've been using it in my patients, which is obviously why you brought me here today.
Yeah, so that's amazing that we know what Sculptra actually is. Can you give us a brief of what the benefits of Sculptra are?
Yeah, so Sculptra, unlike fillers, is a collagen stimulator. So you don't get an immediate volumization, whereas with hyaluronic acid fillers, no matter what brand they are, Juvederm, Restylane, Belotero, whatever it is that you use, will give you an immediate one-to-one correction. Hyaluronic acid, which is a dermal filler, also can be used for immediate volume restoration, but also for hydration of the skin because hyaluronic acid holds 1,000 times its weight in water. Now, polylactic acid, or Sculptra, is, like I said, a biodegradable polymer, which comes from the alpha hydroxy acid family. When you inject it, it induces an inflammatory response. So it creates an underlying low-grade inflammation. And by doing that, it stimulates a whole host of repair. So you get new blood vessels to the area. You get more hyaluronic acid. You get more elastin. You get fibroblast proliferation. You get collagen stimulation. 70% of your skin is made out of collagen. And as we age, and we're aging from the age of 25, we're losing collagen at a rate of 1.5% a year until about 35. And then we start losing 3% of our collagen a year. So the rate of collagen decline almost doubles when we hit the perimenopause. So for women, but also men. And so in their 40s, they really start to notice folds, lines and wrinkles, enlarged pores, loss of elasticity, because collagen is a very important protein. It's a protein that gives structural support to the skin. It helps to reduce the appearance of lines and wrinkles. It supports the skin, but it's also important for wounds repair, cell differentiation. I always say this has not just been given to us to look good. It's got an actual structural function. But it's not the only protein in our skin. The other protein that's very important is elastin. Elastin gives our skin bounce. It gives it elasticity, and it allows our skin to withstand pressure. So as we're losing both of these two proteins, our pores drop open. So people often will come and say to you, oh, I hate my pores. And we discuss a skin plan. We put them on a skin plan. But the reality is what you put on the outside has a limited impact, right? And we can improve the appearance of pores using topical skincare, but we can't tighten the wall of the pore. So having a collagen stimulator or biostimulator like Sculptra actually enhances the overall health of the skin.
Okay.
Because if you've got more collagen and you have more elastin and you've got more blood vessels, then you're getting much more nutritional supply to the skin, an ability to repair faster. And I love to do this before I send them to you for radiofrequency microneedling.
Yeah.
Because if I've woken up and fertilized the skin, and that's what we're doing really with biostimulators, is we're fertilizing the skin. If I've woken up all the fibroblasts, all those cells that make new collagen, then I send them off to you to do the microneedling. Those fibroblasts that were asleep or were non-functional or were not present before are all awake and ready to be stimulated when we do our microneedling. So you get much better results. So it can even be used in the form of skin priming. So there's loads of benefits of Sculptra, both as a volumizer and as a biostimulator and improvement in skin condition. And it helps with elasticity. So you're young and perky, but as you age, your skin becomes a little bit more lax. And people come and say, oh my God, what's all this excess skin? And, it feels a little bit loose and lax. And they dislike that. And so what this will do is it tightens up all of that collagen. It tightens up the skin. And it can be used in different ways. So you can use it to replace volume in the face. You can use it to create a lift. You can treat the temples. So you can treat behind what I call the line of ligaments. There's a line of ligaments that go down to the lateral aspect of the face, where the temples are, the lateral fat pads are. And if you place Sculptra there, you get traction and recruitment of the local tissues. So in English, what that means is that the loose, lax tissues that sit in front of it are given a little bit of support laterally, and you get almost like a ponytail lift effect.
Nice.
So it's really got a wonderful place in aesthetic medicine and regenerative medicine. More and more people are moving away from fillers because they're afraid about migration. They're afraid about looking puffy. They're afraid that hyaluronic acid lasts a really long time. We know that hyaluronic acid is great, but it retains water, and that can make you look sometimes a little bit puffy. Sculptra doesn't do that. It just wakes up all of those blood vessels, all of that collagen, that elastin, and boosts the quality of the skin. So there's multiple ways that we can use it in the face.
Okay, that's really interesting. So it really does differ from a dermal filler and it's got extra benefits.
Yes.
So we know we can use Sculptra for the face. What other body areas can we use it on?
Great question. So this is something that, again, has become increasingly popular. And often I see patients walking in and their face looks 30 and their neck looks 60. They forget, they ignore the neck. And they're not taking their skincare products down to the neck. People are very used to applying moisturizer, collagen stimulation, retinoids, vitamin C on their skin of the face, but they ignore the neck. So the neck ages. And remember that the skin of the neck is much, much thinner than the rest of the face. So Sculptra is being used in our clinic daily in the neck. It's fantastic for the neck and the décolletage. So the skin is the largest organ of the body. And the skin of the face extends to the neck, extends to the décolletage, and all over your body. And often, particularly now in summertime, people are exposed. When they're exposed, their skin is going to be subject to potential UV damage and collagen breakdown. So they'll start to get lines and wrinkles, particularly in the décolletage. So that's the area between the breast, this chest area. And they get these vertical lines that can make them look a lot more aged. They can also get pigmentation. It doesn't look as smooth. So décolletage, this is on label. It's been used for the face, the neck, the décolletage. Often in the body, you need about 3 sessions.
Okay.
And it does depend on your age. As with anything, if you leave a car until it's haggard and old, then you're going to need a lot more work to repair it. But if you look after your car, you see a lot of vintage cars around that have been well looked after by their owners, because actually maintenance is a lot easier and cheaper and cost effective as compared to repair. So if you are in your 30s or 40s, you might just need 1 session. When you're 40s and above, you might need 2. When you're 50 and above, you might need 3 or more. It becomes harder to stimulate collagen as you age. So décolletage, huge one. And then body areas that I think are really interesting that lots of people are concerned about is arms, knees, and bum. So arms is an area that's really of concern to women in particular.
Huge concern, especially in clinic at the moment with summertime.
Yes, and you were treating a patient for this yesterday.
Yes.
And so we do this often in tandem with muscle stimulation. So if you think about the anatomy, and always you've got to think about the underlying structure, right? The arms, obviously you've got your bone and you've got your fat, but the muscles of the arms, like the muscles all over our body, the muscle is probably the largest tissue in our body, not the largest organ, skin is the largest organ. Muscles are important for function. So we need our muscles to lift our arms. We need our muscles to walk. We need our muscles to smile. Muscles are what move and contract. And as we age, we lose muscle mass. This is fact. And that starts to happen from the age of 35. And this is relevant for both women and men. And we say, if you don't use it, you lose it. So you must continuously consider how to stimulate muscle mass. That's very, very important. And this is important for men and women. Now, the function of muscle, apart from movement, is also the maintenance of bone density. So as we age and we lose muscle mass, and in men lose muscle mass 1% a year every year from the age of 35. And in women, we know that we lose bone density. The movement of the muscles and the contraction of the muscles, which are attached to the bone, stimulate osteoblastic and osteoclastic activity. So osteoblasts are the cells that form bone, and osteoclasts are the cells that eat away bone. And your bone is constantly remodeling. Every 3 months, you've got bone turnover. If your muscles are not functioning, and you'll see this in people who break an arm, for example, or break a leg, and they've got to be in a cast, when they take that off, they lose muscle mass. They get sarcopenia. It's called sarcopenia. And so muscle hypertrophy is very important, stimulating and maintaining muscle mass. And so weightlifting becomes very, very, very important as you age. Again, both men and women, weightlifting is not limited to men. This is something that I think is exceptionally important for women, not just to maintain the muscle mass, but to maintain the bone density, right? So muscles, men often lift weights more than women. So we see a lot of patients who come in with laxity in their arms, right? And women start to complain of bingoing, so hanging of their arm area.
Yeah.
And that can be an accumulation of fat. It can be sarcopenia, loss of muscle tone. and it can be skin laxity. So it's important that you diagnose correctly so that we can use the right treatments. Now, yesterday, the lady that we were treating, I think she was 60.
Yeah.
Late 50s to 60. And she had an array of concerns or an array of issues. When we looked at it, she said, look, I hate my bingo wings. What can you do about it?
Yeah.
Thinking that it was a fat reduction treatment. And of course, it was not, because she had a lot of crepiness in the arms. And if you just remove fat, you're going to be left with a lot of loose skin.
Yeah.
So actually, I would say I wouldn't be doing cool sculpting or cryolipolysis or endolift or any of the fat treatments that we have. I would be considering, how can we reduce some of that subcutaneous fat, but stimulate collagen to tighten up that skin before we go and do cryolipolysis? Because one of the worst things is losing lots of fat and then ending up with leftover skin. And how can we increase that muscle mass? And how can we improve your health? Generally, that is a health concern.
Yeah.
So she's now embarking on her Sculpt Neo treatment, which is radio frequency and high intensity focused electromagnetic stimulation, which is a treatment that you do. And then having Sculptra to stimulate collagen for the arms.
Yeah.
And so laxity in the arms, we grade that 1 to 5, depending on how bad it is, on an aesthetic assessment scale. We call this the global GACE scale, or global aesthetic improvement scale, when we're looking at how much have we improved skin quality or the aesthetic outcome. And you can use Sculptra in the arms to improve laxity of the skin, and that's incredible. I think so many women, particularly in the summertime, become really conscious about that because they start to wear, short sleeves, or they're going on the beach and they're really conscious of laxity. So Sculptra is hugely beneficial in that area. And then another area that, again, I know you're treating with a lot of high intensity focused electromagnetic stimulation, is the bum.
Yeah.
So the glutes, which is, the buttocks. Again, this is relevant to both men and women, but I would definitely say there's more of a concern in women, is if they're starting to lose muscle mass in that area. And of course, with aging and with fat accumulation, you can get dimpling of the skin or percutaneous puckering. We call it also cellulite. And you can get little deposits of fat in the area and laxity of the bum. So we use it to improve the contour, smooth out the appearance of cellulite, and also create a lift. So you can use it for volumization in the bum. Yeah, fantastic.
So what other treatments would be great in combination with Sculptra? We know, obviously, the Sculpt Neo is great, but what else would you recommend?
So it's important to understand that anatomically, we're aging and changing from bone to skin. Every single layer of the body is aging. So if you take the face alone, the face is made out of skin on the outside. Underneath that, you have subcutaneous fat. Underneath that, you have muscle. Underneath that, you have more fat to give you support. And underneath that, you have bone. And we know that we're losing bone structure as we age. Bone density reduces from top to toe as we age. And as the bone starts to shrink back, you start to get volume loss, and you also start to get sagging, because it's almost like taking away a table from a tablecloth. You don't have the support anymore. We know that fat starts to deflate over time, which again means that you don't have those plumpy cheeks, and they start to shrink back, and you have sagginess starting. And we know that the muscle starts to become looser and longer, more in women than in men. There's a very important muscle called the frontalis muscle, which is a muscle that lifts the eyebrows. And this is why I'm really against putting botulinum toxin in the frontalis muscle, or over-treating the frontalis muscle, because people hate the lines on their forehead. You'll see that I have them because I want to maintain muscle mass there so that my eyebrows don't start to sag. So it's a trade-off, it's a compromise. And it's important that we look at the face holistically and artistically and understand the pathophysiology of aging. If we just think, well, how can I inject this today, now, to make this patient look good, and not consider how that treatment might make the patient look in 5 years' time, then we're doing a disservice to our patients. So it's important that we understand when we are weakening a muscle, what that actually means. I'm fine weakening the frown muscle, because the frown muscle can make you look angry and aged and unhappy and create the micro expression of don't approach me. But actually, one of the things that women often do as they age is they hold the eyebrows up because they're really conscious of sagging eyebrows. So you want to maintain muscle mass there. And then skin. We know skin loses collagen, elastin, and hyaluronic acid. So Sculptra is not a magic bullet. Sculptra is a fantastic treatment to improve skin quality, but it's never going to replace lost volume in the bone or the fat, or it's not going to be a replacement for fillers or fat transfer, nor is it going to tighten muscle. So if we want beautiful, natural, elegant, subtle results, then we really must address every single layer of the face in order to maintain normal looking faces and avoid distortion. If you just fill faces with hyaluronic acid, because that's all you have in your toolbox, we say if all you ever have is a hammer, then everything looks like a nail. You end up creating distorted, overlooked, overfilled faces that look puffy with migration. And you see that, unfortunately, quite a lot. You see bad work. What you don't see is good work, right? Because well-placed treatments are undetectable. That's the idea of aesthetic treatments, is that we're not trying to just use one tool to solve everything, that we understand that our face is aging in layers, and therefore we'll need to combine our treatments. We'll need multimodality treatment. So I use Sculptra, like I say, as a skin primer. I use it to stimulate collagen. I use it to tighten the tissue. I use it to help improve radiance, hydration in the skin. And I like to use it at the start of my treatment plan, because actually, if the canvas looks better, if the skin is more radiant, if it's tighter, if they've got a lifting effects from it, then they may not want fillers. They may not need filler. And it means it negates the need to use as much. So then we can really focus on what's left, right? We can say, okay, I've improved the canvas. I always say start with skincare, then start with collagen stimulation. We can then do the radiofrequency microneedling, for example. Then let's tighten the muscle. Fillers should really, really, really and truly be the last thing that we do on our patients, unless they want a here and now result.
Yeah.
Fillers are fantastic. It's our bread and butter, and it can give you that here and now result. But let's be honest, it's not an investment. It will degrade over time. And, not everybody can afford that maintenance. So I think it can, the reality is going to be combined with a lot of treatments. It can be combined with anything and everything almost.
Yeah.
But it's important to understand that because it's a biostimulator, you don't want to put two different biostimulators in the same area in the same 6 to 12 months.
Okay.
So, that's, I think, a very important consideration, because you don't want to overstimulate.
Okay, that's great. So for anyone who's interested in Sculptra, who would you say is a suitable candidate for it?
I would say anyone that starts to notice skin laxity, who wants to improve laxity of the skin, or they start to notice that they've got lines and crepiness, those who want to avoid dermal filler or see what else they can do. But I think it's important that they have realistic expectations. You might need multiple sessions to get to where you want to go, and that's not a bad thing. It's better to start slow than to overfill. Who it's not suitable for is an important thing as well. It's a treatment that is suitable for healthy patients. If you have an autoimmune condition, then I would not be injecting Sculptra, because it relies on an immune-mediated response, and it's creating inflammation. What you don't want to do is create inflammation in patients with unpredictable biological responses. So those with autoimmune conditions, I wouldn't do it. And I think they would be at heightened risk of developing nodules or fighting it, essentially.
Okay. So are there any risks or side effects associated with Sculptra?
Yes, there are. This is a medical procedure, and it should be prescribed and injected by a medical professional. There are risks, like with any medical procedure, including bruising, swelling, tenderness at the injection site, which is usually transient. Now, that's to me is not a major concern, because any injectable will carry that risk. The concerns with Sculptra are nodule formation. It is a biodegradable polymer, so it will break down over time, and its effects will degrade over time. But one of the great things about Sculptra is that it lasts 2 years. So that longevity is really fantastic. It means that when we get to where we want to go, you don't really need to think about it for up to 25 months is the documented evidence. And that's based on 30 years of research and randomized controlled trials and systematic reviews. So we know that that is fact. But what that means is, if you have a nodule forming, then it can also be long lasting. Now, if it is persistent, it can be treated. But that's the number one thing that I think is a concern. With the latest techniques and the development and the dilution, it's so low. I've never seen it happen in our clinic, thankfully. I hope that we don't ever encounter it, but it's a risk that we consent our patients for. And it's very important that they then follow our aftercare. So the rule with Sculptra is massage your face for 5 minutes a day, 5 times a day for the next 5 days. Why? Because you want to spread the product. You don't want accumulation of the product in any one area. Otherwise, you're going to get deposition of fibrosis in that particular area. Collagen formation, which is secondary to wound stimulation or wound repair. So it's almost like a scar forming underneath the skin. So you really need to massage. We don't let you go until we massage. We also give our patients a timer, a little timer so that they know to time themselves. We give them a cream to use for their massage, which is a nice self-care thing that they can do at home. We give them a gua sha so they can really go for it at home. So nodule formation, I think, is the biggest risk. Thankfully, it's a very, very low risk. And if it does happen, if it is persistent, then it can be treated. And this is also why we don't inject patients who are not healthy individuals or who have autoimmune conditions, because they are increased risk of developing nodules.
Okay, thank you.
My pleasure. Any other questions?
I think that's it for today.
Thank you so much for joining.